Hey y'all, welcome to Haight Street Voice, and we're here with Andrew Penn, who I am going to read his amazing background here because it's just fantastic. More than 25 years of mental health experience, Andrew Penn was trained as an adult nurse practitioner and psychiatric clinical nurse specialist at the University of California, San Francisco. And I'll get to the nuggets here. He has completed extensive training in psychedelic-assisted psychotherapy at the California Institute for Integral Studies and recently published a book chapter on this modality. A leading voice for nurses in psychedelic therapy, he is the co-founder of Open Nurses, a professional organization for nurses interested in psychedelic research and practice, and was a study therapist in the MAPS-sponsored phase 3 study of MDA-assisted psychotherapy for PTSD. Man, you've done a lot of shit. Let's just put it that way. I mean, it's just amazing. He is also the co-author in a recent article in the American Journal of Nursing, bravo, on psychedelic-assisted therapies, the first in 57 years. As a steering committee member of Psych Congress, he has been invited to present internationally on improving medication adherence, cannabis pharmacology, psychedelic-assisted psychotherapy, and grief psychotherapy, treatment resistant depression, diagnosis and treatment of bipolar disorder, and the art and science of psychopharmacologic practice. Hello.
It's a mouthful.
It's a
Hey,
lot.
Linda.
Hey, hello. It was so good to see you again. So Andrew and you and I had the pleasure of hanging out back in August, and this is sort of part 2 of our hang. And I think since I saw you, I'm been turned on to the fact that Cal Berkeley is doing a fellowship called the Psychedelic Journalism Fellowship, and so it's all about how journalism and the study of psychedelic therapy and all of that it's a whole new terrain we're on, and I'm so stoked to have you here because it's part of my research is going up to people such as yourself that I'm having the privilege to speak to and say, how does this all work? What is the deal? And I thought we would start with the fact that last time you said you were off to Dallas or to Texas. So I kind of wanted to just get an update of how you've been and what you've been doing. What's up?
Yeah, thanks for having me, Linda. Yeah, it's been a busy fall. It's conference season in the academic world. So I've been doing a lot of traveling for that, talking a lot about psychedelic therapy and particularly the nursing angle, the care that we deliver during psychedelic therapy. Has been a topic that I've spoken on in a few different places. So yeah, I just got back from San Antonio last night, where I was talking about this at Psych Congress, which is a really large continuing medical education meeting that happens every year. About 2,500 people usually come to that. So it's a good sized meeting. And did a talk called Reunited and It Feels So Good, just like the Peaches and Herb song, and with subtitle of Psychiatry and Psychotherapy Magnify Each Other with Psychedelics.
Wow.
So
what is the vibe? What is the vibe with these things? I mean, like, my silly brain, I'm picturing like Cheech and Chong are wandering around and like, oh, and that guy,
no, a bunch of what you might imagine psychiatrists, psychiatric nurse practitioners, psychotherapists might look like, from all over the country, are interested in hearing about this, because they're hearing about it from Michael Pollan or from Anderson Cooper on 60 Minutes or the New York Times. I mean, Newsweek just had a cover article about psilocybin for depression. So, yeah, there you go. Look at that. Hey, as if on cue, so it's really everywhere. So a lot of what we're doing is kind of trying to give people the science behind that, to understand what's happening, and also to manage some expectations, I think, because we have this bad history in psychiatry of thinking whatever is coming down the pipe is going to fix all our problems. In the 1960s, it was that antipsychotics were going to make it so that we no longer needed, custodial care for people with serious mental illness, and we closed all the state psychiatric hospitals. And, and that led to, it's a multifactorial problem, but, a lot of the homelessness and that we see people with severe mental illness suffering from, in the 1980s, antidepressants like Prozac were going to cure depression, and that didn't really quite pan out. So, I think the psychedelic therapies are going to play a role in the future of psychiatry. I don't think that they're going to be right for everyone, and I don't think they're going to treat everything. I think so. So I part of what I'm doing is trying to kind of temper expectations a little bit, and just keep us realistic, while at the same time remaining optimistic.
Yeah, that actually was one of my questions is, can psychedelic treatment rid society of the evilness of pharma? That was that's kind of a big question, but
yeah, it's also kind of a loaded question. I mean,
yeah.
I wouldn't necessarily say that pharma is inherently evil.
Yeah.
I think that
I'm being the sort of like,
no,
gonzo.
It's your job to ask the inflammatory questions and my job to bring the fire extinguisher.
Cool.
So
yeah, I mean, great Halloween costume together.
Right. There you go. The bomb thrower in the fire department. Yeah, I mean, pharma certainly has a lot of problems. That's clear. But they also, I think, bring a lot of force for innovation into this space as well. So, so it's a very complicated question. But I think I don't think we know. I think the pharma is very interested in these compounds. There was a lot of sort of fear that pharma would try and contribute to making these things illegal. I've not really seen that. I think there's a lot of parallel threads that are happening. So we're seeing what's happening up in Oregon with Initiative 109. It'll be very interesting to see how that all plays out, where psilocybin really kind of is taken out of the medical model and is probably more akin to like a yoga retreat, where it's an intentional exercise that is done by people who hopefully have some training. That's part of what they're trying to look at legislation around, is what will be required of people to be guides in Oregon. But they are disentangling it from the medical model, which will be interesting. I mean, that could be very successful. It could also have problems. We don't know yet. We don't know.
That was another thing is, how has aligning yourself with the large healthcare organizations affected your own personal journey? So, I mean, does that sort of resonate with you, or you sort of already been in the sort of large health care organizations? But I guess what I'm asking is like sort of the psychedelic with the large healthcare organizations. Has it affected your journey? Obviously it has, but I'm kind of curious as to, with the red tape that you're having to go through and all of that. Can you speak about that?
Sure. I trained and I teach now at UCSF, so I'm in the neighborhood, and that gave me the foundation for understanding, say, things like pharmacology of these substances. I think that's really important, and it helps me understand how clinical trials work. The way that we gain knowledge about these compounds is through research, and that's kind of a slow, dull process. I don't think people, it's kind of like that old saying about watching laws and sausage get made. It's
what
like,
is that? I don't even know.
Like there's two things you don't want to see be made. One is laws and the other is sausage, just because of the things that go into it. And research is really it's about hundreds of small questions that have to be answered. If somebody's appropriate to be a subject in a trial, if we can proceed, what to do with the data. There's a lot of decisions that have to get made in there, but that's how we find knowledge, and knowledge, the scientific method builds on previous knowledge. And so, that's a different practice than faith, and I think historically, a lot of people have come to this from a place of faith. They had a psychedelic experience once or twice or 100 times or whatever, and they know that it works for them, and that's what we call empiric knowledge, right? So that's,
what is it called again?
Empiric. So they tried it, they had an experience, they felt like it was beneficial. And that's very helpful for that person, but it's not necessarily generalizable, so you have to use scientific method to really to be able to begin to generalize knowledge and be able to say, yes, this could be helpful for many people.
Right.
They're just different ways of knowing. And sometimes they're a little bit at odds with each other, because sometimes I think people that have had their own experiences don't see the need for research. They sort of know that, like, well, for themselves that it works, and so why do we need to study it?
Right.
But you also have to understand that there are regulatory agencies like the Food and Drug Administration that regulate
Those guys.
that regulate medicine in this country. And the only way that they are going to approve this as a medicine, as a prescribable medicine, is with evidence. And the only way you make evidence is with research. So that's the process by which you bring these into kind of at least medical legitimacy. I mean, there are other paths to legitimacy,
Right.
the decriminalization
Right.
path is a different one, the religious practice use is another one. So, there are different ways of kind of bringing these compounds into sort of from out of the underground and
Yeah.
into
I've actually been
more
in touch
polite
with
society.
yeah. I've been in touch with Decrim Nature here in SF, and they're really,
Mhm.
they're really making progress. I mean, it
Mhm.
is, this is for real guys, and I mean, it takes, again, it's that slow chipping away thing, but they're really at it, and it is really exciting to sort of witness
Sure.
all of this. And going back to the therapy, I was curious because my upstairs neighbor, she works at UCSF. Hi, Erin. She's a physical therapist there, and she was curious about um, how do you, so basically somebody does a treatment that you're doing here, that you're doing, I guess you're doing for depression, right? That's been your main focus, is how does using psilocybin to treat depression, correct?
That's what we're currently studying. Yeah.
Currently,
In
yeah.
the past, we've looked at MDMA
Right.
assisted therapy for the treatment of PTSD.
So she was curious. It's like if they have 3 or 5 treatments or whatever the amount is, this is sort of what I was trying to paraphrase, because last night we were hanging out. I'm like, what should I ask him? I already knew a few questions, but it's nice to have other people. And she was curious as to, like, let's say a person gets 3 to 5 treatments. She goes, but how? She goes, because I've taken psychedelic. How do you make that? How do you incorporate that into, like, oh my God, I had an amazing trip, but then now I'm on the bus riding the Muni to work, and it's certainly not as fun as it was yesterday when I was in doing the, that expanding my mind. How does it translate into day-to-day life?
Okay.
Yeah.
Well, let's back up and clarify a few things, because
Thank you.
I want to make it really clear that this is that the way that we're using these compounds is not the same way that they're used recreationally.
Right.
So this isn't like, here's a dose, go to a concert, have fun, right? Totally different context, right?
Like Outside Lands this past week, and I'm sure there were a lot of those people.
I imagine there probably were, and that may have its own value, but this is a different use of
I
of
hear
the
you.
tool.
I'm
of the
sort
tool.
of playing devil's advocate here. So
Yeah,
I appreciate it.
So the way that this works is it really, I think where the journalism often gets a little confused around this is that they over centralize the drug.
Mhm.
Right. So, I mean, I always say, if I had $1 for every time I saw a newspaper headline that said, party drug treats veterans trauma, right? I could take us both to lunch, right? And that's a mischaracterization of it. I mean, it probably gets more clicks, but what it really is that psychotherapy treats these conditions, and it's catalyzed or enhanced or accelerated by the use of a psychedelic. And we're only using it a handful of times. And in our current study, we're only using psilocybin once as a way of, we use it one time. And because it's a study, it's what we call a double-blind placebo-controlled trial. So there's a 50-50 chance that the subject gets a placebo, and neither we nor the subject know what they're getting. Okay.
And yeah, you were saying about that last time. Niacin is the other, right?
Niacin is the active placebo that we're
Right.
using. So niacin gives you some effects, but they're not psychedelic, and that they're presumably not antidepressant either.
Mhm.
And before we have that dosing day, we have several meetings with the subject. And when I say we, 2 therapists will meet with the subject for several hours to get to know each other, to get to know what their issues are, to answer their questions and concerns about the potential drug session. Then we have the all-day drug session, and then we do integration therapy in the days following.
Mhm.
And integration therapy is really important because, and this is often a lot of what separates the preparation and the integration are one of the two of the things that really separate it from recreational use. And so in the preparation, you're really setting an intention for what you're planning on working on. This isn't like, kind of grab bag of let's see whatever happens. This is really about like, I want to examine, my grief about when my parent died when I was a child or something like that, and then in the integration therapy, we make sense out of the experience. So we spend several hours talking about what they experienced, what they make of it, how they might integrate some of those insights into their daily life. And we really try to make use of that afterglow. And the research has found so far is that these antidepressant effects last far longer than the drug effects. So, anywhere, there's data up to 4.5 years after psilocybin treatment showing an antidepressant effect. Now, not everyone is going to have that. A lot of some people may start to have symptoms coming back after a few months or maybe after a year or something like that. But what we're really looking at is a different modality than taking a pill every day to treat your depression. So the idea with this is that maybe what we have is episodic treatment. So somebody has depression, they go through a course of this therapy, they do better for a while, and then they don't need to be taking a medication every day. And maybe once a year they come back and we repeat it. We don't know what the durability of the effect will be, but it definitely seems to last longer than the drug effects. So I think that's the important thing to understand.
Yeah. I brought this picture up because, of course, that's mycelium under the ground.
Mhm.
And I feel like my own intuitive thing is that it's affecting people's brain. It's actually going into their brain and lighting up certain parts that have just been, forgotten or lost or caved in. And it's like that's behind me, like the way it looks.
Yeah, one of the ways that you can think about depression is it is an experience of being disconnected. It's there's a researcher in the UK named Roz Watts who's done a lot of really great work around
He's
this.
great. Yeah, I've seen that guy. He's great.
She actually,
Rosalind. I thought you said Roz.
Yeah.
Okay, sorry, different guy.
Rosalind Watts.
Okay.
Yeah, Roz Watts has done some really nice qualitative work around this, looking at what is people's experience of depression, and how does that contrast to when if psilocybin has a positive effect, psilocybin therapy. What does that look like? And what she has identified is that, when people have depression, their experience is often one of disconnection. They feel disconnected from other people. They feel disconnected from their own self. They don't feel like themselves. They feel disconnected from pleasure. They can't enjoy things, and they feel disconnected from kind of the larger world. And what's interesting about mycelium, as you point out there, is that mycelium is everywhere. Fungi are everywhere. If you walk around Golden Gate Park, you won't see them, but they're there. And so when we see a mushroom pop up after the rain, what we're seeing is kind of analogous to the apple on a tree. The apple is not the whole tree, obviously, it's just the fruit of the tree. The apple tree is the whole thing. But when we see that mushroom, it's like an apple. But underneath the ground is this massive network of mycelial threads that connects, as it is in your illustration there, connects different members of the community, if you will, of the ecological community. There's this great term, the wood wide web.
Yeah, that's kind of what you mentioned it last time, and I did my homework, and it's beautiful. It's wonderful.
Yeah, Richard Powers' book, The Overstory, that's a great work of fiction, kind of touches on that a little bit. Awesome. But it's a real thing. It's not just metaphorical. This mycelia connect trees in the forest, and they actually share water that way. They share nutrients that way. It is an information kind of superhighway that connects the larger system. And maybe at the risk of getting a little sort of metaphorical and fanciful here, what happens under psilocybin is often people will have an experience of what is referred to as awe. And awe is this big sense of like, wow, the world is so much bigger and more intricate and more beautiful than I could have ever imagined.
Mhm.
And I'm a part of it, but I'm not the center of it. It's this interesting thing that
Oh.
there's a guy named Dr. Kellner at Berkeley who talks about the small self, that, a lot of times maybe our unhappiness comes from really getting, we get caught up in our own heads. There's sort of an old saying in meditation practice of don't believe everything you think, right? But, when we're depressed, our brain kind of lies to us. It says, no, nobody loves you. Nobody wants to be around you. You're going to feel this way forever. And there's this idea in the psychedelic
It's kind of like Eeyore in when
yeah,
you're
exactly. Yeah, and it's sort of stuck in that depressed mode. And there's this idea in psychedelic neuroscience that in a non-depressed brain, new information coming from what they call the bottom up can come in and sort of permeate through the brain. So, if you go to, let's say you're not depressed and you go to outside lands and you see a bunch of friends that you haven't seen in a year and a half because of the pandemic, and you have a great time, I'm not even talking about drug use. I'm just talking about seeing people that you care about and being hugged and saying, oh, I've missed you. And, if you don't have depression, you can sort of take that in, and that will lift your spirits. And you're like, oh, so good to be together again.
Yeah.
If you have depression, what may be happening is that your brain has become really good at suppressing that new information coming in. So what we call top-down inhibition. So the brain sort of it overuses these previous experiences, which are kind of reinforced in depression. So, you see your friends and they're hugging you but you're thinking, yeah, if they found out what a jerk I am, man, they wouldn't want to be around me.
Right.
Like if they found out how lazy I've been during the whole pandemic, like they'd think I'm a flake,
Or they think my hair looks stupid right now.
Or they think my hair looks stupid, or like, and that it prevents that new information from coming in and really sinking in. So what's interesting about psilocybin is that for those few hours, what it seems to do, it seems to take off that top-down inhibition with somebody who's depressed, so that for at least a little while, this new information can kind of come in. And when the psilocybin wears off, things have reorganized maybe in a more flexible way, in a way that people are more able to kind of take in a new perspective. And maybe that's what has the antidepressant property. Maybe that's why it endures, but it also really reinforces why you need that integration therapy.
Yeah.
Because if you just take the drug and then go to work on Monday, it's not to say that can't have its own benefits, because it probably can, but it often, what it ends up being is a novelty.
Yeah.
It's like, oh, remember when we went to fish and we took mushrooms, and
that was
amazing.
Yeah.
That was an amazing show, and that's sort of full stop. Like there's no integration of that.
And
so
that's sad. I mean, that's actually kind of depressing, like, oh, I was having so much fun yesterday, and today is really, that's almost like worse, because you've had this really good time and now you're like, I'm back on the bus,
Exactly. And this is why, for people that do engage in recreational psychedelic use, integration circles like those that are offered by the San Francisco Psychedelic Society can be really helpful, because you can talk to other people about those experiences in a relative degree of confidentiality, and really start to think about, like, well, what was it about that concert that was so amazing? Why did that have such a profound experience on me? Oh, it was because there was beauty and there was connection with other people. And then the question becomes like, well, how are you bringing beauty and connection with other people into your life now? Could you do that every day? Could you, make a practice of every day you're going to reach out to at least one or two friends, and even if it's just a short phone call, how could you bring beauty into your life? Could you make a practice of getting flowers every week at the farmer's market?
I do that.
Yeah, exactly. And it may not be huge things, but those serve as integration of something which could otherwise just kind of be relegated to a novelty.
I would like to say there that, even as a, I hope I'm a bit of a nutbag, but aren't we all? But even being normal and, not having, thank you, not having bipolar, I'm pretty much a pretty normal person. Life's hard,
Absolutely.
it's not like, oh, I don't have any of those, mental issues, but it's just I mean, all life is suffering. You know, I mean, it is a challenge, but that's the beauty of it. But I mean, I
Yeah.
just kind of wanted to point out that it isn't like we wake up and it's zippity doo dah every day. You know, it's not
Well,
unicorns and rainbows every day, even though I do
no,
live in the Haight,
absolutely.
you know, but
And yeah, you might see more unicorns than average, and more rainbows for sure.
yeah,
But you know, it really does point to you know, I mean, this last year and a half, right?
oh,
You know, I mean, I think we've all been through the
Jesus.
ringer,
Yeah.
and just we're all well, many people are really hungry for reconnection.
Hmm.
You know, I just came back from this conference and there was a couple thousand people there, and even though it was, you know, we were still wearing masks and that, but you know, it's still like, oh, it feels really good to be back together again,
Hmm.
from this, because you know, we are social creatures, we are interconnected creatures, and that's great imagery behind you. um and you know,
I always want to know what Toto and Dinah, what they saw. Oh, goodness,
right,
Andy.
yeah, yeah, that's right.
Sorry to
I'm sure
interrupt you.
if they could say the same, they probably would agree. But yeah, you know, we have this, that's, you know, aside from, of course, the, you know, 750,000 people in the US who've died from this thing, you know,
Um,
one of the great injuries has been this disconnection that we've had, and you know, and a lot of people struggle with connection already,
yeah.
you know, because they're anxious or because they have depression,
Mhm,
you know, and so for those folks it's been doubly hard. So there's a lot of healing to do.
mhm. Yeah. I mean, also, I would like to give a shout out to COVID. That sounds weird, but I mean, it's also on the other end of the spectrum. It really made a lot of people that I've been in touch with, like, really like put a fire under their ass to really do what it is they're here to do. Like,
Yeah.
you know, for my magazine personally, it's like, I mean, I've always been doing it, but it's like, okay, it's like go time. Like, let's really make this, let's start really diving in, connecting with the right people, such as the SF Psychedelic Society. I've talked to Daniel Negrin. She's awesome. You know, he runs the Haight Street Shroom Shop. You know, these great people, and this guy right here, hang on, sorry, I like to bring up my background so we can talk about what's going on. This guy right here,
Ah,
yeah,
Dave
I mean,
Smith,
I
yes.
just adore him, and I mean, he is
Yeah.
just so excited about feeling, he feels like he stepped back in time, but it's now. And that, you know, this whole, you know, he's the founder of Haight Ashbury Free Clinic, everybody. I'm sure most people know that, but he's a doll. I mean, he's starting a center over here on Stanton, and the working title that we're all calling it is the Haight Ashbury Psychedelic Center, where
Yeah.
you can come read. There's going to be a library. There's going to be even Sonny's involved with learning how to make tie-dye. It's going to become some sort of center in this area of learning. Of, it might even be Haight Street Voice headquarters of where people can come talk about psychedelics, learn about psychedelics, learn about alternative therapies, be around people who are thinking the same way,
Yeah.
hang out. And it's really,
Yeah.
thank you, Dr. Dave. You know, it's
Yeah,
beautiful.
thanks, Dave. Well, you know, a lot of people, a lot of people are unaware that before John Lennon invented LSD, no, that's not true. John Lennon did not invent LSD. Albert Hoffman discovered LSD a good 20 years before the Beatles were ever even making music, I think. So that there was this period for about 25 years that was happening, where there was really respectable research going on in medicine, particularly around, in psychiatry, particularly around addiction medicine, particularly around palliative care and end of life, looking at psychedelics in a very sober way. And a very, you know, so the article that we wrote in the American Journal of Nursing was we like to say it was the follow-up to a 1964 article that a woman named Kay Parley wrote, about, it was called Supporting the Patient on LSD Day. And she was a nurse in Canada working in a state hospital with people that we would now call out having alcohol use disorder. And they were using, she and Humphrey Osmond were using LSD to treat patients that couldn't stop drinking. And so there was a lot of that kind of research that happened. There was research happened in the US at Spring Grove, Maryland. There's a whole history that happened. There were hundreds and hundreds of papers that were written. There were international conferences. And then then the Summer of Love happened, and this sort of got out into the popular culture thanks to people like Timothy Leary and Ken Kesey and all the sort of the usual suspects, right? And psychedelic rock, and it was transformative to a whole generation. And then there's of course a backlash that happened with the Controlled Substance Act and Nixon and such, and it really put all that research onto the deep freeze for good
And
25 years.
forgive me for being my girlfriend is very much into this whole, and we're not going to go down this road, but this whole MK Ultra thing and mind control and
so this is a fascinating idea, right? There's this Jung had this term anandrodromia that refers to, it's like when you look at the yin and the yang, the one gives way to the other, opposites give way to each other. And so on the one hand, during the 1960s, you had 1960s, you had the youth culture, Timothy Leary and Richard Alpert, Ram Dass talking about using LSD to expand your mind, to free your mind, right? And then you had the CIA through MK Ultra looking to see if this could be used as a mind control drug. So I mean, these are total opposites with the same drug, and psychedelics tend to kind of inspire these sort of opposites. So yeah, it does have kind of a sordid history, and I to be clear, I'm not an advocate of sort of indiscriminate psychedelic use. I think these are very powerful tools, and even if they're going to be available outside of a medical setting, which something like Oregon might allow that to be the case, I think they need to be approached with a great deal of reverence. I mean, these are, these come from traditions where they are not intoxicants. The psilocybin tradition, the ayahuasca tradition, peyote tradition, these plant medicine traditions, these are not things you go out and party with your friends with. These are tools for deep inner healing work, not only of oneself, but of one's community, for spiritual work. They're sacraments. You could get drunk on communion wine, but it would be pretty tacky to do so, right? So I think that psychedelics need to be approached with similar reverence, because they're not trivial. These are big experiences, and for somebody who's unprepared for them or in a setting, I mean, one of the things that Dave was doing harm reduction before that term existed. When they set up the Haight Ashbury Free Clinic, Dave looked at the Haight and said, this is going to be a catastrophe if we don't help these kids out, because they're showing up with bad trips and syphilis and all the things, that I mean, the Summer of Love had some casualties too, and Dave was kind of there to help clean up the mess, and a lot of people that helped him out. But he was doing what we would call harm reduction. So we do that like at Burning Man through something called the Zendo Project, where we have a space where people can come if they're having a challenging time, whether they're on psychedelics or not, it doesn't matter. A lot of people are just having a hard time there because they're tired and they haven't, eaten well in several days, and they're dehydrated, and they just had a fight with their partner, and they're kind of having a rough day and they need someone to talk to, and we're there for that too. But this idea of let's take care of our community, let's take care of each other. We don't need to bring the last place that you probably want to be when you're having a difficult psychedelic experience is with law enforcement, or in an emergency room. So now sometimes people may need that to keep them safe,
of course.
I mean, we don't want people to get hurt, but ideally you can sort of prevent and mitigate that with good community support. And then part of harm reduction is just understanding understanding, appreciating, and respecting the power of these compounds, that they're not just sort of trivial recreational. It's not just like having a few drinks, it's a lot bigger than that.
I really like this whole thing of community. Obviously, my magazine, Haight Street Voice, is hyper local. It's a hyper local with a global perspective. And it really is, it all starts with community, and I never thought I would hear myself saying that, maybe 15 years ago. I was a music journalist and, community, schmunity, but maybe as I get older, I'm getting wiser, or I'm just settling more into I've lived in the neighborhood 35 years. It's like it's everything to be able to walk down the street, and I know all of the street kids here, and they're starting to say the same thing. The ones I know, at least, the majority of them, I can't say all of them, but I can't speak for all of them, but they're really they're really hyper aware of really needing to take care of each other out there. Be nice to the guy on the corner that owns the new store. It's like, oh,
Yeah.
not the new guy. It's like, wow, okay, this is cool. This is the new guy. Let's protect him. And they actually have guarded his store for, just on their own volition. When they see something bad going on, they're out there protecting too, which is such a beautiful thing.
Yeah, that's wonderful.
Which really leads me back to Dr. Dave, and then I'll let you go because I know you're a busy man. But Dr. Dave, I almost started crying, but when we were talking about, when I interviewed him for a couple of issues ago, we were talking about the Haight-Ashbury, and I mean, he lived through that amazing explosion of counterculture and music and beauty.
Sure.
I mean, he holds it in his heart. But he did say, he said, the 60s were amazing, but what can we learn? What did we do wrong? Well, how can we not, because it's the Renaissance is rumbling. What did we learn, and how can we make it better this time around? Can you speak to that? Like, what can we do differently?
That's a good question. That's a really good question. I mean, one of the things that I think happened, I'm not sure there was a lot of good integration that happened from the 60s.
Yeah.
Culture tends to be sort of pendulous, it goes. And so, if you sort of look at the 60s and what happened within 10 years was this, in the 80s was this sort of hyper materialistic culture. And it's always interesting to see what drugs are popular during a given time, right? So what happened in the 80s? Cocaine, right? I think of cocaine as almost being like the polar opposite of psychedelics, because if psychedelics are about kind of dissolving ego, stimulants tend to be about inflating ego, right? And so fascinating that within 10 years of the Summer of Love, you see this pivot towards it's about me, and it's not about community. It's about what's in it for me, and how can I kind of get as many marbles for myself, and
another 8-ball.
Yeah, exactly. But to answer your question, my hope is that these really will be treated with a lot of reverence, that they will be appreciated for their power, and that they'll be used with a lot more intentionality perhaps than they were back then. That this is not something, Alan Watts, the great English sort of Buddhist philosopher of that era, 1960s, said with regards to like repeated psychedelic use, he said, when you get the message, hang up the phone. You don't need to keep going back and doing the same thing over and over again in order to get that same message, because you've already gotten the message. And so maybe this sort of it felt, I mean, of course I was born after, just after that period, so I didn't live through it, but from what I can kind of gather, it feels like there was sort of a hubris that went with it. It's like, let's do it all now, and there's sort of there was this sort of bacchanal that was happening, and it was really about in some ways about excess, and while I mean, human culture has had periods of I mean, that's where the term comes from, right? I mean, the Greeks had bacchanalias, right? But you can't live like that year round. You can't live like that every day. I mean, that should be a special occasion, right? And the reason why we don't have Christmas every day is because it would no longer be special, right? We call them special occasions because we don't do them all the time, right? So it's actually the infrequency of the experience that makes it special,
right? Like Bob Weir likes to say, he says everything in moderation, including moderation.
Moderation.
There's a happy area,
right? And there may be times for excess, but then you can't live like that year round. It's like Jack Kornfield says, after the ecstasy, the laundry. It's like you've got to get back to regular life. And I think the challenge of this era is integrating this into regular life. So because psychedelics in the 60s became a sigil for not being part of the larger culture, right? So Tim Leary infamously, tune in, turn out, drop out, right? Well, okay, that is a revolutionary path, right? And it bore a lot of fruit, but it also kind of arguably sort of fizzled out within a fairly short period of time.
Mhm.
So how do we more deeply integrate this so that we don't have the classic pendulum where, because I mean, what was the fallout of the Summer of Love was, the Controlled Substance Act,
Mhm.
and arguably there were a lot of other things that went into that. I think having an unpopular war that was being fought by young people was sort of antithetical to psychedelic use.
Mhm.
If you've had LSD, you're not going to want to fight Nixon's war, right? So that it was in the sort of the interest of the powers that be to prohibit that, to try and
Mhm.
and quash that.
And I think
But
a lot of young kids were coming in, and again, it comes down to communication. Like they came looking, I mean, it's sad because they were people, young kids that were looking for something more beautiful than their lives were. And they came here and they took the drug, but they weren't educated about it. It was just thrown at them, or they just took it. And it wasn't, like you said, it needs to be integrated and understood, and communication. And
absolutely.
yeah.
And I think what we need to appreciate is nuance, right? So the first casualty of war is truth. The first casualty of the war of drugs was credibility, right? So there was a time when somebody like me, this academic, licensed professional, would be seen as kind of a representative of the man, right? I'm not, and so what I think we need to do going forward is to really, information, honest information is a way of reducing harm.
Mhm.
If people know that, maybe starting out with 7 grams of psilocybin, if you've never had psilocybin before, might be a really terrifying experience. That's good information to have. So somebody doesn't do that right out of the bat and terrify themselves.
Mhm.
Um, certain drugs shouldn't be combined, for
Mhm.
example.
Mhm.
That we need to give people honest information so that they can make safe decisions for themselves, rather than saying, all drugs are bad all the time, and then having people have to try and navigate that space without any good information. But
Mhm.
there's a responsibility on the part of the user too, to remain in some place of moderation.
Mhm.
And obviously some people with addictive disorders, part of what's not working for them is their capacity for moderation. That's why they have an addiction, right?
Right.
Fortunately, classic psychedelics are not terribly what we call reinforcing. Most people don't take LSD and say, I'm going to do that again tomorrow. Most people are like, wow, I got to digest
Whoa.
that for a while. That was a
Yeah.
lot,
Got to get my
Uh,
molecules back together.
exactly,
Yeah.
right. And so it doesn't, whereas cocaine, as soon as it starts to wear off, people say, oh, give me another bump. So that's reinforcement in an addiction model, right?
Mhm.
So I hope, my hope is that the culture has gotten a little more mature in the last 50 years,
Mhm.
and my hope is that there can be a greater kind of nuance that happens
Mhm.
in the conversation
I
and
think
in people's
COVID,
behavior.
I
Yeah.
think COVID blew a hole in a lot of, I think it helped. I mean, it's horrible to say that, but in a lot of ways, I do believe that it sort of like blasted people to go, what the, wow, life is, wow, this isn't what I thought it was. So I think a lot more open-mindedness may have come out of it, and more of an acceptance about the work that you do. And hopefully, maybe I'm just being
Yeah.
hopeful, and I live in the hate, and I'm being a unicorn and rainbows girl, but I mean, and then this is my last question too. Well, it's two-part, is, in 20, let's say, where are we now in 20, let's say in 5 years, in 2027, do you see a big, huge change, or what's your vision? What do you see? Is that too hard to answer?
No, I don't think it is. I mean, I reserve the right to be totally wrong on this, but I mean, if I was, I was like, say, if I could predict the future, I'd be investing in the stock market more. Um,
I would
but
do.
well, the where we are in terms of research is that MDMA for PTSD is in the second half of what we call phase 3, which is the last phase before it's presented to the FDA for approval. And so if MAPS, the Multidisciplinary Association for Psychedelic Studies, is correct, they're probably looking at FDA approval of that as a therapy. Now, mind you, this is not going to be a take-home drug. This is not something you're going to get prescribed and you go pick it up at Walgreens. This is going to be something that's done in a clinic or hospital setting. And it's not, and this doesn't mean it's legalized. This just means it's medicalized. So that it's important to make that distinction by about 2023.
Wow.
Psilocybin is a little further behind. So there are two phase 2 studies going on for psilocybin for depression. And, if I had to place a bet, I'd say maybe 25, 26, maybe. It really depends on how those trials go. I mean, you also have to remember that, this is sort of an unpopular opinion, but things can fail in clinical trials.
Yeah.
And if they can fail in a number of different ways. I mean, it can fail because, especially phase 3 trials, you have to have a much bigger pool of patients that they're less cherry picked. So they look more like the patients you're actually going to treat. And when you do that, sometimes it doesn't work as well as it did when you're kind of more cherry picking your subjects. Or there could be a bad outcome. There could be a suicide or something, God forbid, that where the FDA says, "Ooh, this actually looks more dangerous than we thought," and may make the sponsors of the trials go back and look at that, or look at how we're gonna take precautions against that. So there's lots of things that could happen. This is not set in stone. That's why it's research. If we knew the answer to the question, we wouldn't need to do we wouldn't have to do the studies. But yeah, I think that will happen. I think, or depending on how things go in Oregon, I think you could see, I mean, there's already a move in California. Scott Wiener has introduced a bill to legalize. I don't think it was the most well-written bill because it conflated plant medicine with white powders. I mean, they put ketamine and MDMA in there, which, they are psychedelics. They're synthetic. They're not manufactured by plants. So it gets trickier, it gets trickier to differentiate those things out. But I think if that is successful in Oregon, then I think they will probably be the template for other states to look at, perhaps decriminalizing psilocybin, or creating I mean, we can see from the cannabis space, I mean, people forget that cannabis is still illegal under federal law. It's still Schedule 1 drug, even though there's now something like 35 states that have some degree of medicalization, or as we have in California, outright legalization for adult use. But those laws are in violation of federal law. It's just the feds haven't decided to enforce them in a long time. But they could. It's unlikely, but they could. So there may be a similar path that happens with psilocybin. It's hard to know. It's everything's changing so quickly. That it's really hard to know what exactly will happen next.
Is that sorry?
Oh,
I was totally listening.
It is a sousaphone. The top of a sousaphone that I turned into a music. I have a Bluetooth speaker in there.
Awesome. So good for you. All right. And now I'm going to let you go. But one last thing, and myself being a journalist and applying for this fellowship, which Cal is amazingly offering. Like, what would you like to say to future journalists, people like myself? What's the best thing I can do to help purport the awesomeness of the work that you're doing? What angle, or what can I do to help?
Yeah, I think again it goes back to that question of nuance. While that sort of party drug treats PTSD is a really eye-catching headline, it's sort of misleading. And I also think it undervalues the value of therapy. That psychotherapy really is at the heart of this. The drugs just help to accelerate it. And so to really seek to understand what happens. Yes, sorry, my dog's making noise. I love it. That's good. That to really try and understand what happens between the person going into the study and coming out of the study feeling better. What happens in between those 2 points? I mean, this is something I'm particularly interested in as a nurse, and my training is as a nurse. I'm interested in the care that we deliver to patients during that time. I think that's a lot of the healing comes from that care. And so I think if journalism could look at the process as well as the outcomes, I think that would be great. And also I think to help to keep expectations modest. I think these sort of panacea stories where it's like, psychedelics are going to put big pharma out of business. I just don't see that as happening. I mean, there's going to be people for whom psychedelics are not appealing, that they don't want them, or that they don't work for them. There's no treatment treats everyone. for everything. And I think there's a lot of sort of panacea story going on right now. I think it's a reflection of how hopeful we are and how desperate we are for better treatments. But I think what that does is it really sets people up for disappointment. Because there are always going to be people that any treatment doesn't help. I mean, we saw this happen with SSRIs in the 80s with Prozac. You know, SSRIs were going to cure depression. Well, that didn't really pan out. They helped a lot of people. So it's important to make it clear that, like, you know, that there will be benefit, but it may not be as widespread as we'd hoped.
Right.
You know, so modest expectations, I think, is part of what we need to focus on.
Okay, cool. Thank you so much for your time. And what would you like, I always ask everybody this, what would you like to say to the Haight Street community as well as the global community? If you could, this is a loudspeaker and you could say anything to anybody, I mean, something to everybody in community, about the work you're doing, whatever you want to say.
Yeah. Well, you know, at UCSF, we're just up the hill from the Haight. You know, it's really kind of part of the Haight is really part of our extended neighborhood, as is all of San Francisco. You know, this is really an amazing incubator for ideas that come out into the world. And, you know, a lot of the studies that we're doing in the lab where I work, you know, we're looking at psilocybin for depression right now, but in the future, we'll be looking at psilocybin treatments for chronic pain, for people with depression and Parkinson's disease, people with bipolar 2 depression, and people with methamphetamine use disorder. You know, these are all studies that we're going to do in the future. So, you know, hopefully these are going to be findings that that we can build upon going forward and really help to change the world.
Yay. Thank you. Much love.
Thanks, Linda.
Yeah.
Thanks, Linda.
All right. Peace.
Bye
Have
now.
a good one. We'll be in touch. Bye.
Okay. Bye.
Peace.